Yeah.
Okay,
No,
well, I think we'll get started. You all know I'm Kathy Johnson, and I do these things once in a while. And living here, having been a nurse and now living here, of course, I'm attuned to what people say. And just like the falls prevention came out of concerns that people were, I mean, I'm gonna take off this so that you can hear me better. I promise not to get too close. People were concerned about the people that they had, lost from falling. Also was hearing a lot about advanced directives, and Dr. Lang, when were you here? You were here not too long ago doing a session in the fall, a session on advanced directives. And, but I was wondering about just the do not resuscitate order, which can be, if you want it, be part of your advanced directive. But I think there's a lot of misunderstanding about what a do not resuscitate or DNR order is, what it does, how you go about it, getting it, processing it, and does that mean you're doomed? So I thought it was time to really get some clarification about this so that you know what you're dealing with. I asked Dr. Lang if he would also be here because he is a real advocate for advanced directives and for planning. What do you want to happen when you have a severe illness? So Dr. Lang is here to, I said, we can just tag team. I'll start and we'll go through as you have questions, as he sees a need to fill in, he will do so. So we'll just kind of play this and see what happens. I did, because this is a serious topic, and I know that can make people uncomfortable, I did try to inject some humor throughout the, I was really doing a lot of laughing and looking at some of the little jokes and so forth. So I thought this guy probably was wishing he had a do not resuscitate order so that they wouldn't bring him back from heaven. Okay. There we go. So we'll talk, what is a do not resuscitate order? And here we have, unfortunately this didn't copy, this is, wait till you see our new defibrillator. It's a Michael Graves design. Specifically, it is simply this, and this is, I looked at and based this entire presentation on the law in Wisconsin. Wisconsin's law regarding do not resuscitate orders. So whatever is in here is in the Wisconsin state law. Every state does things, or most states do things a little differently. So it's an order written by a physician. And particularly when you're in the hospital, we always talk about orders. Whatever, the orders that the doctors write direct the nursing staff, therapy staff, direct the other staff as to what they should do. And essentially, that's what doctors do, is they write, this is what we want to happen. So it is an order, it is written by a physician, and it directs emergency medical technicians, first responders, healthcare facilities personnel, you go to the ER, to not attempt CPR if you suffer a cardiac or respiratory arrest. Okay? Yes?
What's a respiratory arrest?
I'll let Dr. Lang, I know, but I'll let him. He's
respiratory arrest means you stop breathing.
Yes.
If you stop breathing a short time after that, everything else will shut down because you can't live without breathing.
Exactly.
You get cardiac, of course, and a heart attack, right?
Well, it could just be a rhythm problem, but whatever the cause, the heart stops beating. Matter of fact, the
Heart
blow to
stops
the
beating.
chest
Sorry?
can't stop your heart.
Ellen?
I'm to stand up.
Oh, she wants you to stand up.
This okay if I take this off?
Yeah,
Yeah, please.
I forgot what the question was, but your heart can stop for different reasons. It can stop because of a heart attack, and it can stop because of an arrhythmia. But whatever, it stops. And if you don't do anything, with minor exceptions, because sometimes the heart can actually restart itself. Little League is very popular both here in the US and in Japan. And sometimes little leaguers at the plate will get hit in the chest with the baseball. In Japan, interestingly, they know this is a minor problem, but they all wear vests when they bat. So that's how they've eliminated this problem in Japan. In this country, the child may be hit in the chest, collapse to the ground, the heart has actually stopped. But kids are much more durable than I am at my age. And the heart may restart itself. The heart's pretty durable. But as you get older, it's less durable. So I don't want to bore you with that, but this can happen at any age. And sometimes it resolves spontaneously. Other times it can be started by beating on the chest, although that comes with certain risks and benefits, as is everything in life.
Okay. Yeah, so heart attack is just one potential cause, lots of things. And in younger people, of course, sometimes work-related, electrical things and all of that sort of thing. So, some people have been telling me, well, if I pass out, if I can't respond, you can be passed out, but that doesn't mean you suffered a cardiac or respiratory arrest. What is specifically refers to is if your heart stops working, your heart stops beating. And as Dr. Lang said, if you stop breathing first, pretty soon your heart's going to stop too. Okay, so they do that together. So the purpose is to ensure that medical care provided in the emergency department, out of hospital settings like here, or you're out shopping or wherever you are, that it's consistent with what you want, what the patient wants, the person wants, and with his or her authorization. So that's really it in a nutshell. Okay? Any what's going through your heads?
Okay.
Penny?
I'm looking at that and thinking, well, it's the physician's authorization that is finalized. But if you don't give them your feelings, they can make the decision on their own.
Well, you have to sign.
Okay.
Yes. The doctor cannot write that kind of an order without there being.
What happens if somebody's heart stops beating? They've never made this choice before. They are now in the hospital. Okay, what happens then? Who makes the decision to stop?
Whoever you have appointed to be your spokesperson, if you are unable to speak for yourself.
I'll bet that there are lots of people who go to the hospital for the first time.
Yep.
When this happens.
Absolutely.
They don't have anybody that
Correct.
chosen.
Yes. So what does that mean you need to do, all of you?
We all need to make sure that we get this done.
An advance directive.
Exactly. Yes. Yes. It's all about planning ahead. Planning ahead. Oh yeah, here, you'll never take us alive. A lot of people believe that if they have created some type of advance directive, that this will be covered in there. Okay, how many of you have advance directives? Okay, so some of you don't have advance directives yet. Okay, I hope by the end of this session you'll be asking about what to do. Okay, to do that. Some people believe though that the do not resuscitate order is part of that. Isn't that part of what's in the advance directive? No. Short answer is No, it generally is not unless you specifically make that document. So here we can see that what an advance directives essentially are telling people who are involved in your care what kind of treatment you want or don't want, and who will speak for you. Who is going to be the person, either in or out of your family, whoever you choose, who is going to be your spokesperson? Because you will need to have somebody. And that's really, certainly was not that way necessarily when I started in healthcare. I mean, this is really something fairly new in terms of like 50 years. So, yes, Judy?
It sounds as if you have to have this piece of paper with you at all times.
We are gonna talk about that. You don't need the paper, but we'll talk about what the Wisconsin law says. We're gonna get to that point. Yes, you do have to have something. So at this point, I think people are thinking, there's so many documents. And you know, what's an advance directive and what's a living will and all of that. And Dr. Lang is an expert at all of that. I liked this little graphic because it shows the advance directive is really an umbrella term, okay? The advance directive is the planning you make in advance for what you want as you get older, as you may face illness, and ultimately you're going to face death. We all are. So that's what the advance directive is. It's all those things that you put in place to have your wishes for the end of your life. Or maybe not quite the end, because maybe you're going to go to the hospital, be severely ill, and your living will be addressed. But some of the documents that might be part of your advance directives are, you might have a power of attorney. You know, who is going to be, if it needs to happen, who is going to be the person that's going to be your financial, look at your financial situation. Okay, if you are not able to take care of that yourself, who is going to be that person?
And actually, a financial power of attorney is a little bit different.
That's true. Well, you're right, yeah.
Because a financial power of attorney, most presidents don't have the time to manage their own money.
Yes.
Because they're managing the
Well,
country.
that's true.
So they set up a financial power of attorney, and that person handles their money.
Yes.
So that's different. But
Yeah.
you'd be surprised how many of my patients had a financial power of attorney
Yeah.
and who did not have a healthcare power of attorney.
Yes.
Which one's
Right.
only about money, and the other is about how you might choose to die.
Exactly. So another document is the healthcare power of attorney. Who is going to be your healthcare proxy? Who is going to speak for you? If you are unable to speak for yourself, if you get to the hospital, if emergency services are called, who is going to speak for you if you can't speak for yourself? So you need to think about who is that person. I had my brother, but he's 8 years older than I am. So he's 79, is now diagnosed with bladder cancer. And so he's got his own fish to fry. And we don't have children. So I asked my niece, who lives here in Milwaukee. And so she will be the person that we put in charge of all our stuff. And she graduated top of her class in pharmacy. Yes.
What if you have no close relative?
Then, well, Dr. Lang, you could probably speak to that. You need to find either a person or a lawyer, is probably most often.
Well,
what
you know,
people do.
you may have a friend
Yeah.
that you would trust. And that friend might happen to be your attorney.
Mm-hmm.
Wouldn't have to be. Sometimes clergy are thrown in that role.
Mm-hmm.
Your doctor cannot be your healthcare agent.
Right.
However, maybe a friend of the doctor could be the healthcare agent. Although they'd have to work, if they're working in the same system, I think that's a no-no also.
Yeah, probably.
But if you have a doctor that's system A, and they know a doctor that's system B, maybe that you could convince that person, but not everybody's willing to be, if you will. I think, I usually give talks about how you are president of your healthcare. I remember a bunch of years ago, there were people, and I forgot who the top of the ticket was, but some people thought Colin Powell should run, and Powell said, no, I don't want that job. So not everybody wants to do this. So somebody that you trust and somebody that's willing to do it, those are the two, I'd say those are the requirements.
But that is something you really have to think about, isn't it? Do you want one of your family members? Maybe, like me, my siblings are almost all older than I am. And the one that's younger has so many health problems that, I'm not going to burden her with it. So, we do have to think about that. And we'll talk more about family as we get into this. Living will. Okay. How many do not know or do not have a living will or know what a living will is?
What is it?
Okay, we're going to get that. Hang on to that. And other things would be organ and tissue donations, a document that says this is what I want done in terms of donating parts of my body. Yes?
Aren't we all too old for donating?
No.
No?
No. They won't take anything not usable. But
I have a wonderful response to that, because sometimes people, my initial healthcare power of attorney was done in 1992, but don't think I'm so smart. I only did it because my attorney told me to. So I have that same Egyptian gene called denial, but my attorney knocked that out of me. So later on, some patients say, well, they don't want any of my organs. If they don't want any of your organs, they'll tell you. They'll come and assess you. Maybe there's something they'd be interested in. So let them decide if they want it. If you're not eligible, fine. But eligibility changes not only with your age, but with technology.
Yeah.
So if you're willing to be a donor, volunteer. That doesn't mean you'll get picked. But you don't know that.
Yeah. Always worth. Did you have a question, Bill?
No, just about the living will.
Okay, yeah. We're gonna get to that.
What about giving your body to a medical school? Is that even done anymore, for cadaver reasons or?
Yes, it is. I just signed up last month.
Okay, and for sure you get used then maybe, or maybe not.
It depends on if there's too many donations at a particular time.
I see.
Okay. But let them decide.
Yeah.
If you want that, and in all likelihood, they'll take your body, but I can't guarantee it because I'm not in medical school.
When my mother and father had both planned on giving their body, my father because he died of heart disease at the age of 51, so there was a lot of stuff going on. But it happened that their crematorium was broken down, and so they had bodies stacked up, and so they couldn't take my father's body, and so here we are, getting. Fortunately, there was space in my mother's family's plot for my dad, because it was a last minute. Oh, we've got to do all this stuff now. Yeah.
But if you donated your body to a medical school, then it would be their decision what time to send you to the crematorium, would it not?
Yeah, well, absolutely.
Yeah,
Are they finding your body so entrancing that they want to save this for many students?
Oh, I'm sure that's the case, right?
Okay, so living will. A living will is something that, as it says here, outlines your care preferences in the event you become incapacitated. So do you want, for some people it's, I don't want to be tube fed. No tube feeding. You jump in here, what's kind of...
You could say no ventilator.
Yes, no ventilator. Which would not be the same as a DNR. It's more the, yes, do resuscitation, but only go so far as not to put not to put me on a ventilator.
Right.
Yeah. So anyway, so that's what the living will is in the event you become incapacitated and can't speak for yourself, you have written on there, and I just realized I have handouts at the front desk that I'll give you. It's the handout from the Wisconsin Department of Health that outlines a lot of this information. So before you all leave, I will run down there and get them and give them to you. So, and I made it in large print, so larger print, so that you can all read it. Yeah. Yes.
I have a question in terms of a living will. Do you have to make a list, or can you say, I don't want any extraordinary measures at this point to save my life, or does it have to be very detailed?
Well,
that's a good question.
Yeah, that's an excellent question, and that's how come there are doctors that really don't like that, because what's extraordinary to you might not be extraordinary to somebody else, and what does that mean?
Right.
So you could say no tube feeding, you could say no ventilator, okay? But to say no extraordinary means, well, what's an extraordinary mean?
Like tube feeding and
Well, okay,
ventilator.
then you should define it. And
Yeah.
you can.
Because how do you think about all that stuff that doctors and nurses do?
That's the value of a
Yes.
healthcare power of attorney that you
Yeah.
can trust, that understands what your goals of treatment are. And you could say comfort measures only.
And then they would get that, they would know that that wasn't.
Well, then, but you may want to define that. You may say no surgery, no antibiotics. Okay, and some people say this stuff. I trust my healthcare power of attorney to carry out my wishes, because it's really complicated to try to list everything you can think of.
I know,
Yeah.
that's what I mean.
Yeah.
That's why the healthcare power of attorney, I'm
A
much
doctor
more.
could do it, or a nurse, but a regular person.
Even then, it's a lot of paper.
So isn't
It
this,
is, but it also maybe just needs to be somebody who, because you can't necessarily find a medically oriented person to
Right.
do it. Is it needs to be somebody who is not afraid of talking with
And listening.
and listening and learning, and is not afraid to ask questions, is not afraid to question what the doctor said. You know, tell me, what does this mean in terms of the long-term survival? What does this mean in terms of what discomfort somebody's going to be experiencing? You know, lots of questions. If somebody is willing to do that and to put aside their own sort of judgment for a moment, but knowing what you wanted, and what does that mean? So
isn't this sort of included in the health power of attorney thing?
Yes.
It is, kind of. In
It
fact,
is, but you
it's
still,
more
you're using presidents as an example. What would have made the death of President Kennedy worse? Anybody want to guess? Nobody wants to guess. Usually there's he doesn't die. No, I did say that. But what would have made President Kennedy's death worse?
if they had prolonged.
If our forefathers had not created the role and process of a vice president, that would be worse. And so after Kennedy is buried, President Johnson would address the nation from the Oval Office, and he would say, quote, I understand the American people did not elect me to the office I find myself in, end quote. He would then go on to say he believed it was his obligation to carry out President Kennedy's political agenda that included civil rights. And before that, President Johnson was not known as a champion of civil rights, but now he is.
He was an opponent before that.
You're correct. President Obama talked about that one day when he got sidetracked about what the real subject was.
Johnson was the opponent when he was in the Senate.
Right, absolutely. And President Obama pointed that out. Normally you don't criticize a dead president for your own party, but he did.
it was an interesting situation.
It was but it shows how a healthcare power of attorney is supposed to work.
Yeah.
Now, a vice president becomes president in the United States. It's a tradition that they carry out the former president's agenda. But for a healthcare power of attorney, you're obligated by law to follow the instructions in that document.
Yes.
That's a little bit different.
Yes.
So you can remove, not you personally, but let's say there's family, oh, they wouldn't want this, and it says right here, they wouldn't want a ventilator. And the healthcare POA puts them on a ventilator. They can go to court and have that person removed because the document clearly said no ventilator. So the healthcare power of attorney cannot change that.
Right, and so the healthcare power of attorney is a person, but they need to know what's in your living will, because that's what they are obligated to.
Or in the healthcare power of attorney.
Right.
It could be right there.
Right, yes. So a living will is a legal document, but it is not equivalent to a do not resuscitate order.
And it's not equivalent to a healthcare power of attorney.
Exactly, yes, exactly. Right, that's why those are all different pieces. The living will is just this same thing that says, this is what I want or don't want, should I not be able to speak for myself and I end up in this situation. The healthcare power of attorney is somebody you say, okay, you're gonna speak for me, but you're having to do what I said.
So this really isn't necessary if you have a really good health power of attorney.
And what if they get hit by a bus?
Well, then you have an alternative, you have an alternate.
Right.
There you go.
Speaker of the House is next. Yes.
Yes.
You always have.
Oh, that, I forgot about that.
Yeah.
Yes, sir.
Can the living will have something like, I don't want to be resuscitated in it?
Well, you can have that in there, but it has to be an order from a physician, and the living will is not an order from a physician. So it would not be,
Enforceable.
right, exactly.
Is the living will a document, a legal document?
Yes, it is.
Oh. So
Yes.
it's- oh.
Mm-hmm. And yeah, you can get rooked by all kinds of people on the internet with living will documents. So the living will takes effect if you can't express your wants. Okay, so you have all this stuff so that if it happens that you can't say this is what I want or not want, this is what I don't want or not want. It's right here. Is this sort of making sense? Okay, if you think of the advanced directives as these are all the plans I'm making, and then these are the parts of it, the living will, the various powers of attorney, the do not resuscitate order, those are all the pieces that describe what you want and who's going to speak for you. If you think of those two questions, what do I want or not want, and who's going to speak for me? Those are the two things. So the do not resuscitate order is focused specifically on resuscitation. And you remember that only happens if your heart stops, not just passing out, not just being unconscious, but if your heart has stopped beating. Okay, or your lungs have stopped working, you're not breathing, because shortly after, yes, you will stop. Your heart will stop. So, and this is according to Wisconsin state laws, specific measures that are in the law includes the chest compressions. You see that on TV all the time, right? The defibrillation, so that the zaps. Cardiac resuscitation medications. I still remember, having a code, what they call the code. In the hospital, a patient has had an arrest, and the team of people that comes to take care of this situation with their crash cart is filled with different medicines designed to get the heart beating again, stop the irregularity, whatever it is. Lots and lots and lots of medications. Intubation or other advanced airway management, I'm not sure what that is.
Well, that's going to be put down what's called an endotracheal tube into the lungs. And you don't have to be on a ventilator to use that. You can then hook that up to a bag and just manually bag the person and move air in and out of the lungs. So you could do that, and you might say no ventilator. That would not prevent intubation.
Right. You have to specify.
Right.
Yes. And I know the literature talked a lot about a separate order for do intubate.
Yeah, which is always pleasant because sometimes patients disagree with that.
Oh, I know. Okay. Or artificial ventilation, you know, which essentially is ventilator. Okay, anything popping into your head? Thinking about it, okay. Okay. So again, I really want to hammer on this, that a DNR order says that medical personnel will not try to revive you if your heart stops, okay? If you have a DNR order and you're wearing your bracelet, which we'll talk about. So what about if you are here in the hallway and you have a cardiac arrest right here in Lindsay Hall, you have a cardiac arrest. What does that mean? Or you're in the Metro store. What happens if somebody, even if you're wearing your bracelet, doesn't even know about a bracelet, but they start doing CPR on you? They can do that, and they are covered by the Good Samaritan laws in Wisconsin. So if it's in a situation where you're in a public setting and you have a cardiac or respiratory arrest and a person, I know CPR, they can do that and not be harmed in any way at risk for legal action. They will be protected. It's unfortunate because can be, as Dr. Lang said, it's not easy to endure. I mean, there's a lot of pain and agony, perhaps. It should not impact other aspects of care. And I remember, I remember things being said, well, we won't give antibiotics because they have a DNR. Well, of course you give antibiotics. They didn't say maybe no antibiotics, they just don't want to be resuscitated. The fact that a person does not want to be resuscitated in case of arrest does not mean you want no treatment, okay? So if you have pneumonia and you need antibiotics, you don't have to not get antibiotics. No other care should be prevented. In fact, that's a legal liability for any healthcare personnel who use a person having a DNR order as a reason to withhold any other treatment. Okay, and it's interesting, it does happen. I have a friend who is volunteers as a guardian for disabled, for people who are unable to speak for themselves, and often disabled people, and particularly with COVID. Oftentimes, it was not unusual for people to just assume that, well, this is a disabled person, so we don't need to treat them. It actually happened. It was not a good thing, but Janine has had experience with dealing with hospital personnel who says, well, they're a DNR. We shouldn't have to do all of this.
D does not stand for disabled.
Yes. So she really goes to bat for her wards, you know, not wanting to deny them. But it's a constant battle. I don't know how she does it, really. She's a great nurse. And resuscitation does not include the Heimlich maneuver. Okay, the Heimlich maneuver, you know, you're okay. I once saw a Brussels sprout fly across the room. So yeah, it was pretty amazing. Some of those scenes, you know, just live in your mind forever, don't they, Dr. Lang? Okay, so this doesn't mean it's dooming you to you know, certain calamity. You still are alive and you have rights. There are so many cute little cartoons with a heart being arrested for cardiac arrest. And for some reason, to me, this little cop looks like a potato. I think he might be a kidney, but he looks like maybe a kidney bean. And here we do the defibrillator. I would have gotten away with it too if it weren't for that meddling defibrillator. So a do not resuscitate order applies only when a person experiences either cardiac or respiratory arrest. I want that to be really clear. David?
How long does the heart have to stop before you have brain damage?
It's gonna vary by age, because once again, the body is more durable the younger you are. But I think usually it's quoted as 8 minutes. Goes beyond 8 minutes, you're in real trouble.
I have a question about resuscitation. When you resuscitate a person of a certain age, what happens to, what process does that resuscitation do to their body? What happens to their body, their brain, when you attempt to resuscitate?
So complications of resuscitation would include chest wall injury, where you break some ribs. You may cause, because you're beating on the chest and the heart's right behind all of that, you could cause bleeding around the heart with a bloody pericardial effusion. If there's too much blood in that sac around the heart really can't work. You can bruise or injure the lungs. Broken rib might injure one or both lungs. Sometimes you can injure organs that are nearby. The spleen, the liver are just below the diaphragm. Certainly there's the possibility of damage to the brain, where you may end up with a seizure disorder or suffer a stroke. Stroke just refers to the brain not getting enough blood flow, which it needs, and it's like not getting oxygen. And there's, for people that survive CPR, some of them have post-traumatic stress syndrome and or depression, because now they sit around worried, even if it was totally successful, when's it gonna happen to me again? So those are the major complications. As opposed to, you mentioned how we see CPR on TV all the time. There was actually a study of some programs you may recall from the 90s, St. Elsewhere, Chicago Hope, and ER. And they had a 75% success rate with CPR, and no one, absolutely no one had a complication. And that's known as entertainment,
Exactly.
not reality.
What if a person has a pacemaker?
Yep. Well, the pacemaker may keep on going. That doesn't mean, the pacemaker delivers an electric shock to the heart. That meant to pace the heart when the heart, and most pacemakers are monitoring what the heart is doing. So if the heart's pumping away, the pacer's not doing anything. It's monitoring that. But if it notes that the heart's not responding, it'll start sending out these, and some people's pacers are going all the time. I mean, it depends on what it's there for. And I've certainly seen people that were dead and the pacer was doing just fine. It just wasn't doing anything to help the heart.
Yeah, I was thinking in terms of like the pounding on the chest.
Oh, I'm not, well, the pacers, a little bit out of the area where they typically beat on the chest or shock the person. So I don't think that would have a particular risk with it with respect to CPR.
Thank you.
Okay.
It could affect the lead placement because you're beating on the chest. The heart's moving all the time anyhow in a normal circumstance. And usually the leads become pretty well embedded after a short period of time.
Okay. So we've talked about what a DNR order is. We've talked about advanced directives, and the DNR order would be can be part of that advanced directive. So here we have people. Yes, we should talk about our final arrangements so the kids aren't burdened with it. And he responds, "Why should we care? That'll be their problem."
Oh, geez.
And she says, "Right. Well, at least we talked about it."
That sounds typical, actually.
I would not deem that a successful communication. Yes, really not.
Where do you find these guys?
Yeah, on the internet, you just,
Yeah.
You know, just search, CPR comics. I mean, just get all kinds of stuff. It's just amazing. Try doing, gosh, sometimes I've been shocked at what I see also when I'm doing some other types of talks that can sometimes have a little political cast, even if it's not directly. Whoa, I've just been, oh my gosh. So here we have a person who does not have advanced directives. He has nothing. And here's his family. The doctor's asking, what's his position on resuscitation? And his family says, well, we don't honestly know. We've never had that conversation. And this is just so, and believe me, both of us, I'm sure we've seen just so often where families are just in this, it's just, I cannot tell you what a burden it is for the adult children to know what to do. They're so torn. They don't want to lose their parent, but neither do they want to also do what the parent would want. So,
They
it's
don't
just.
want to feel guilty.
And they don't, well, of course, they don't want to feel guilty, and you don't want, do we want to burden, the next generation with all of this guilt? And it is, it's
All the
just,
trouble they were, they deserve it.
well, sure, but. Oh, they're not all little angels. Anyway, the thing is that to make sure you have your wishes included in your that set of things in your advanced directives, inform whoever your healthcare agent, whoever is going to speak for you, the healthcare power of attorney, whoever, and inform your family of what your wishes are. Yes?
Can you have more than one healthcare agent? Like, I have some nephews.
That's never been asked. I suppose you can, but it could be problematic. In terms of if person A and B are not in agreement, if on the other hand it's a situation where together they can support each other in doing what the person wants, that might be good. I certainly, for jobs, I like job sharing, and I think that's a great thing.
I
Yes.
just wanted to say to question is that my mom put 3 people in charge in cases that, it was in a different state though, so it might be different. That she put 3 people in charge of her healthcare directive, and she put them in the order in case something would happen to one or the other.
Right,
So that's
right,
okay.
yeah,
Primary and secondary rather than co.
exactly, yeah. And that's good planning ahead, or the way things are in terms of travel and so forth. A's not available, better go to plan B. So that's why it's important to really get everybody in on this and make sure everybody's, and Dr. Lang gave us a link to something that we'll be showing you that talks about talking about. So I thought this was really funny. Here we have 2 little thugs here, and he has a do not resuscitate tattoo. He says he may come to regret that one. So, now in the state of Wisconsin, that wouldn't be legal. It would not mean anything. It would not be something that can be fulfilled. It's a meaningless thing. An interesting tattoo. Also, you can change your mind. This is not an irrevocable thing. Just like your will. Your will is not necessarily, you make it once, and then something happens and you want to change it. Same with this. Maybe you talk to the doctor about this order at a particularly bad time in your life, and and then you think, well, maybe I don't want that right now. I don't want to take that step. So yeah, you can just, and all you need to do is take off the bracelet. And that's it. You don't need to do any more except communicate to everybody who thinks you have a DNR order.
Does the bracelet have to be a specific bracelet?
We're gonna get to that.
Okay.
Yes. So to revoke it, it can be revoked by removing or asking someone to remove the bracelet and notify the doctor.
Wouldn't you have to undo the legal documents somehow? I mean, you
Isn't
said
that interesting?
That's why you let the doctor know.
Yeah.
you let the doctor know for sure.
I usually tell my patients that they should keep the original.
Yes.
Because the original is, just tear it up and take off the bracelet. Because paramedics in Wisconsin are taught to look for the bracelet or
Yeah.
pendant. Some people have a pendant or bracelet, and they will honor that. So if you tore up the document but continue to wear the bracelet, things will happen or not happen.
Yes, exactly. You got a bracelet, I don't care what you say.
You're probably not talking at that point.
Yeah, that's true. And I thought this was, I reserve the right to change my mind about everything, anything and everything at any time, including the DNR order. So.
I can just envision a refrigerator with all these documents that are going to be looked
Well,
at.
you probably want a file.
Actually,
Although-
I don't think we're going to talk about this document, but there's something called PULSE, which is a
Yes.
physician order
I've
also.
seen that, yeah.
And in lacrosse, it's widely used in lacrosse.
Oh, really?
That's where it's, and it's used other places, but more so in lacrosse. And there the patient is encouraged to put it on with a magnet on the refrigerator or put it in a clear bottle inside the refrigerator, because that's where the paramedics know to look if they're called to your house. It's just for PULSE, which is usually a brightly colored piece of paper so they can identify it as, that's what they're looking for.
And that stands for, remind me.
Physician's orders for life-sustaining therapy, which may be a misnomer, but.
Yes, or not.
Or not, depends.
Yeah.
And it covers everything. And once again, it's gotta be signed by a doctor, because it is an order, physician's order.
And I was gonna ask you if that is something that is in vogue here, is used much here, or?
It's, there are many doctors who would like to see more of PULSE. And by the way, PULSE now comes in different names.
Mhm.
Don't ask me for all of them, but I don't know exactly what they mean. But other popular names from my perspective, the same thing, would be POST and MOST.
Oh.
And these are very similar documents. And physicians want this because then my thoughts, not theirs necessarily, they don't have to think. This is an order and that's what they're gonna do. Because sometimes, like, I don't want life-sustaining therapy. Well, what does that mean?
Yeah.
Okay, so they don't wanna be put in that position, they want a clear cut. The problem is, and bizarrely, the state of Wisconsin has not recognized any of these forms. And that's how come they're not so popular in Wisconsin, but the Gunderson people and Mayo
Madison.
Clinic has a clinic in the same area.
Yeah.
They don't care what Wisconsin says.
Right.
It's a physician's order.
Yeah.
So, but technically, there's no liability coverage for a doctor that honors those orders.
Okay, I was wondering, because I couldn't find anything in relative to Wisconsin.
Other
about that.
states recognize it.
Okay.
Not all, I don't know what the
Right,
breakdown is,
right.
but it
Okay.
varies state by state. And right now, the legislative,
Tenor,
atmosphere, that wouldn't happen.
yeah. Okay. So can a family member override your wishes for do not resuscitate? Anybody who thinks yes, they can? Okay, correct. No, they can't. For one, doctors are bound. They're supposed to follow your wishes. And no family member has the authority to override those, he's gonna disagree.
Unless somebody lies.
Well, yes, yes.
They told me.
Yeah.
Yeah.
But legally.
Doesn't it have to be a doctor's order? It can't
It
just-
is a doctor's order, but what if they didn't, what if the person's being dishonest?
Yeah,
And they say, oh no, they called me last night to tell me they didn't want to be resuscitated.
yeah.
That's not right, I'm just saying that's,
Yeah, but that's too bad. I mean, that's not a legal document.
I understand, but then now you have, if you will, confusion.
Yes, yes. Helen, we'll do Helen first, then Bill.
Well, yesterday, I didn't know whether I was gonna make this meeting, so I called the Milwaukee Fire Department.
Uh-huh,
And I spoke with Captain Brautkowski,
uh-huh.
and he said on this issue of a family overriding, that he's had family members cut off
Yes.
the bracelet to protect others.
Yeah, I know, isn't that sad?
Wow,
It really,
that's
I
really
mean,
terrible.
yeah, and some family dynamics are just really interesting. And yeah.
Wow.
But like Kathy said, you can reduce some of this
Mhm.
by, and let's say, you know, somebody mentioned 3 people that were in line for being a POA. That's how come you want to let your family know that
Yeah.
this is A, this is B, this is C, and these are my wishes. If you have any questions, ask them now.
Yeah.
Not later on.
Yeah.
So that's why you want to be open and transparent about this.
You
Because
really-
that really cuts down. on the
Yeah, you
problem.
really do. My mother was a very secretive person. I mean, my mother was almost paranoid. And so none of us knew anything about, you know, we knew that there was an envelope in the underwear drawer. You know, but that was only to be opened if she was not there. So, you know, I mean, if she had passed away. So, yeah, it is a tough situation. It really is. The more people who know, who really love you, but not to the point where they want to keep you forever. Yeah, you really need to. Bill.
If you put a bracelet on,
Mm-hmm.
DNR, and then you tell your doctor that's what you want, does that constitute the doctor's order?
No.
Well, where does
You
the doctor
have
have
to-
to write the order?
He has to, when you, and we're gonna talk about that. Hang on to that thought. Okay. This is really just reiterating. This is just really reiterating that the whole purpose is to allow you to make this decision when you can. When you are in a position of being able to make that decision. And now, if you do not have a DNR order, and you are unable to speak for yourself, whoever is that healthcare person can ask for a DNR. They can. You don't have a DNR order. The person who is in charge of your healthcare now is speaking for you. They can request a DNR order. And in that situation, they're the ones signing for you. They can also ask for it to be revoked.
And when you're if you're admitted to the emergency room, that bracelet, that order is still intact. But if you get admitted to the hospital, that order goes away and it has to be rewritten.
Right.
Huh?
That's true. Yes.
Every time?
Why?
It's the law.
Well-
That's what our legislators have given us.
What if you've already given the hospital the order?
I'll
Yeah.
have to look at.
It's already on file in your folder.
But it goes away when you're admitted by
Oh,
law.
well, isn't that?
No, I'll have to find
Yeah.
it, because it's not part of 154, which is the DNR.
I can make suppositions, and maybe they take the point of view of the patients now in the hospital, maybe they change their mind. That's quite a leap of faith, however.
Mm-hmm, yeah.
I'm just saying.
That's interesting.
Yeah, but
Interesting.
it's
So
stupid.
it gives you more, it's very stupid, and it means you got more to think about. Yes, John?
I think it was last Sunday as I was going out to get the Sunday paper. There was a fire engine here
Mm-hmm.
with 4 or 5 firemen all ready to run into a burning building.
Oh, yes.
And when I came back, they were leaving and a Bell ambulance was here. And I don't understand the relationship between those two events. I'm assuming it was the same
May not have
Pharmacy
been,
patient.
may have been a different,
It could have been, but when do you call which, and, how do they know, or what kind of treatment can they provide on site?
Well, I presume, seeing how there was a fire truck here, someone called 911. That's a little bit like sending off an ICBM. And
I
because,
think though there are union rules that
well,
require, yeah,
I'm gonna give you a long explanation here. When they come, maybe they found out that this person, didn't want certain services, like, and maybe they were well enough that they didn't need the paramedics, but maybe they needed transport. I'll use an example, maybe they fell and broke their hip, but that doesn't require paramedics.
right.
The paramedics may have called an ambulance for them because you want to take care of the broken hip. So I'm guessing something that, and yet they found the person needed to be taken to the hospital, as opposed to, there's no broken hip, they're fine, because then they just leave.
Yeah.
But apparently an ambulance was called, although it could have been two totally
Two
separate
total
calls.
different things,
I
yes.
did tell my patients that when they do not want to be resuscitated, and it goes back to that doesn't mean you don't want care,
Right.
that don't call 911, call an ambulance service to get you to the hospital.
Oh, I
Because they can
suppose,
take care of you, because once again, paramedics, if they don't see the bracelet, they're gonna do everything, because they're obligated to.
No, but ambulances do not have paramedics?
It depends on the ambulance system you have. All the firefighters in Milwaukee have had training as paramedics. I don't know the staffing for all the different ambulance services. But if you're really looking for a ride, stealing, I guess, a line from, although he didn't want to ride, President Zelensky in Ukraine. If you're only looking for a ride, an ambulance can do it just as well as the paramedics. Paramedics, there's a limited number of paramedics, so if they're taking somebody just for a ride, that means somebody else might not be getting emergency services. That's why they work with ambulance companies.
Although it might be a situation where the person in the home who finds the person may not recognize whether or not there is
Their status.
whether or not there's a cardiac arrest, or they're just unconscious. So in that case, you wouldn't want to call 911.
What's the procedure here?
If they find your bracelet, now I don't know who they call, but they would not call, if there is a cardiac arrest and you're wearing your bracelet, they would not call 911 for a paramedic.
All the staff knows that?
That would be part of their orientation, yes.
But how would you know for sure if someone really has a cardiac arrest? Unless you're,
Well, yeah, if you're not trained, I
If you're
suppose
not
they
trained,
do,
yeah.
but,
Well, there'd be no pulse, there'd be no breathing.
yeah. Take it from me, you pretty
You
much,
catch it.
right, Joanne?
okay.
You know, you're a
Right, and I
nurse.
know from, I fell the last time, and it said it was protocol here that they had to call 911, the fire engine came rushing up. And so they took my blood pressure, and did an EKG, and determined I didn't need extra care.
But I think that's what they do, yeah.
So what the staff learns in their orientation is remembered 6 months or 6 years later?
Probably.
Well, I think it is probably something that is reviewed
Refreshed.
yearly. Anyway, when I worked in healthcare, certainly it was.
I'm talking about here.
I would imagine it is. I can check on that, Jim.
It would be a good idea to check on that.
So,
Because if it isn't, we need to get this system going.
yeah. I feel pretty confident that, now, I don't know about private pay caregivers. I don't know, there's one right there. In terms of what you are, taught about if a person, you find a person who's.
I know, because I am private, I would ask the family members if they have a DNR and go for from there and ask them the procedure that they would want me to do.
Yeah.
I think that was me.
Yeah. And I think usually the procedure here, and that's a good question, I will verify that, is to have the nurse come over. And boy, you don't wanna waste time on, if they get caught up. That brings up a good issue. I think I will address that. We'll put that on the health board agenda. Helen?
I'm just confused about something.
Yes.
To have an authentic DNR, does a doctor have to write it?
Yes.
I can't just put on.
No.
Say I do not.
No.
Are you sure?
Oh, absolutely.
You can write it, it's just not legal.
Yes. And it won't be
Honored.
It won't be honored.
So you have to have a different doctor ready when you get to the hospital, because there are hospital doctors?
Well, only if you're admitted to the hospital. If you just stay in the emergency room, you're still okay. I know that sounds crazy, but that's how it is.
Okay.
So it's good in the emergency room, it's not good in the hospital, and now, part of the reason I give these talks, I keep getting smarter. What I don't know is if you're admitted under observation, what that does.
Oh, yeah.
Which is another,
Oh,
I'll find out though.
yes, we will.
That's like a waste of time.
Hospital systems have these, human rights records now,
Yes,
and they have a section where they say advanced directives. Does
Right.
that have any impact on the treatment?
well, that should give the doctor access to whether or not, what your wishes are.
Yeah.
Okay? And it's what's called on a banner bar when they open up your chart, so it's there. I'm not convinced all doctors look at that every time. And let's say you're in the emergency room and there's some emergency going on, how many things are they gonna click on that page? Don't know that. So, it's always good to have that advocate, that healthcare power of attorney. I did have, I thought about this as you were describing some scenarios. And I had this patient that for whatever reason didn't want to wear the bracelet and was at Mayfair Mall by himself. And he fell over. And you fall over at Mayfair Mall and you fall over and you're not talking, what do you think happens? Paramedics are called. Paramedics would document that when they got there, he was a pulseless non-breather, no heartbeat, no breathing, so they went to work on him, which, nothing wrong with that, because they were called.
Right.
And by the time they got him to the hospital, he had a little bit of blood pressure, and his heart was beating again. He wasn't breathing, but they were bagging him. They had intubated him in the field. And when you have a patient like that in the emergency room, they don't stay there very long. A little bit like President Reagan being shot. Although in this case, he got moved to the ICU, President Reagan went to the operating room. But that all happened very quickly. But they did go through his pockets because, unlike President Reagan, they didn't know who this guy was in their ER, and they found his wallet, and they called his family. That included his healthcare agent, who had a copy of his advance directive. And they came in, by the time they got there though, the patient's already up in the ICU, on a ventilator, some blood pressure, on pressors, but not breathing. And so the healthcare agent, and it said, no CPR, no ventilator. And he couldn't stop the CPR because that had already happened, that was done, but the patient was on a ventilator. And the healthcare agent said, stop the ventilator. And they said, we can't because we have to see how this works out. By the way, if that was the NFL, you'd throw the flag because that's illegal procedure. And so the healthcare agent made a deal. And the deal was, we're going to go to the media, or we want Dr. Lang here. Guess what they chose? So I arrived on the scene, and I asked to talk to the attending, and I printed in my note that nobody had done anything wrong yet, but now you lack permission to continue this treatment, and that could be viewed as an assault.
Absolutely.
And so I signed the note, and the doctor was busy, but later on, within the hour, the nurses were kind enough to call me. The ventilator had been discontinued, and the patient died. Fulfilling the patient's wishes. Yes,
No, I was making a little joke. You were successful.
I was successful in
Yes.
making sure the
Yes.
patient got his wishes. But I would say the healthcare power of attorney was successful.
Yes, yeah. And of course, we all remember Dick. You know, he fell in his apartment, hit his head, but refused to wear his bracelet. And so he too ended up on a ventilator. And it was agony for the family that, you know, they're saying to the emergency people, he doesn't want DNR.
But they didn't have the paper
They didn't have the bracelet.
and the bracelet.
There's a bracelet.
Yes, here, Betty has her bracelet. So, excellent.
We've been talking basically about heart attacks. How does this apply to somebody having a stroke?
Well, a do not resuscitate order just talks about the heart. So if you suffer a stroke, your heart may keep on beating.
Right.
You may lose control of one side of your body, or it may affect your speech, or a little bit of both. But the DNR order really wouldn't play a role in that because your heart's still beating.
Yeah. As long as the heart is still beating, doesn't matter.
So what kind of order do you have to write in terms of if you have a severe stroke?
Well, I would suggest that I don't know of an order like that.
No.
But I do know that if you talk to your healthcare agent, that if they know what your goals of treatment are, they could be very helpful to the doctor speaking for you if you lost the ability to speak for yourself, because you can have a stroke and still speak for yourself. A stroke doesn't mean that you've lost that ability. Although some people with strokes do, it varies.
Yeah. Does that answer your question, Dave? Okay. Now, this is what nurses talk about all the time, is we're going to have it tattooed on our chest. I think every nurse I've met, they're going to have do not resuscitate. But of course, that wouldn't be legal, right? It wouldn't be, yes. What do you
But
think?
it might give pause to the people that are about to do it.
Absolutely, absolutely. Look for the bracelet, look for the paperwork. So you visit your doctor, your primary doctor would be the one, and the doctor, and talk to them about this. They are supposed to give you information about the resuscitation procedures you've chosen to forego, is exactly what the law says. So this means that if your heart stops, we're saying that people are not going to do chest compressions, they're not going to give you the medications, not going to intubate you, and they need to talk to you about how to revoke it. You know, if you change your mind, what do you do? They need to then complete the DNR, and there's a form. There's a form for the DNR order. The doctor signs it, and you sign it. And if somebody is a healthcare agent, somebody is doing this for you, they would sign it. Okay, so doctor and patient or spokesperson. And then they either are supposed to give you a little plastic, like a hospital bracelet, you know, with the insert in that says that, or information about getting a metal bracelet. Okay? Now, we're not going to go through all of this. This is the state bracelet.
From a private company.
From a private company. That really quirks me. And I wonder who's getting paid.
It used to be a different private company.
It used to be a different private company, and now it's and now
Nobody knows why that was changed.
Exactly. Who knows? But they will still honor the other ones. So that's what the law says. So they would prefer that you order the bracelet from, and I looked on their website, and this was the only kind they had, was this particular metal bracelet. However, they also do nicely give information, and again, this is on the handout that I'm going to go get, and leave Dr. Lang you can connect to your movie if you'd like, your TED Talk. Anyway, it tells you what exactly you have to have on your bracelet. The law specifies certain things. Now, I don't know how strict you have to be about that. I don't know.
About which?
They require that all of this information be on the bracelet, on the front side, on the back side.
I just thought it was on one side, but I could be wrong. I think there's a number that relates to your document. So if
Okay,
they wanna look at the document, you'd have that number. It's
Yeah.
like a license plate sort of.
so you do want to keep that document like posted. And here's some bracelets. There are all kinds of nice bracelets. You have a lovely bracelet. You have a lovely bracelet. But you do want to make sure that you can get the information on that the law says. So anyway, and there are gazillion things on the internet, all kinds of things. But you don't get sucked in, and I just wanted to include these last two little jokes. Now this one, of course, every healthcare worker or anybody who's gotten training in CPR, excuse me, I need a new torso. This one has a do not resuscitate order. And here we have another policeman arresting a heart, the cardiac arrest. Do you have any idea how fast you were going? Now, of course, anybody with atrial fibrillation knows it can be pretty darn fast. So anyway, I thought they were very cute. I really liked that one, though I need a new torso. So, okay, any last minute questions? Okay. Yes.
I'm still not very clear about calling 911 or ambulances, or what do you do when you or somebody you see there is
Do we call the nurse?
very bad off?
Well, see, here you're supposed to push the button, and of course, if it's you and you're living alone, you will not do that. Which, of course, then you won't be checking in either. So, but anyway, that's a very good question, because ordinarily you push the button and the nurse is supposed to come, and they make the decision about who to call. Now, I'm not sure if my husband were in a situation like that I would even want to wait. I would probably just want to call 911 myself. I really would. I'm sorry, but I would. And I'm going to kind of explore that. Yes, Bill?
Well, my wife went to the hospital from here recently. We pushed the button, the nurse came. They called the fire department. The fire department came and they called the ambulance service.
Because she didn't need
any treatment.
She just needed to go to the
She
hospital.
just needed to get to the ER.
Yeah. I think if you are not sure at all, if you're just not sure, you call 911. That's, to me, always the safe thing to do.
But isn't that the service we're supposed to be getting here?
That's the point, you're here. One of those.
Oh, absolutely, but and that's what I've got right now. The process is you push your button, the nurse comes, and makes that decision. I'm concerned about the lapse of time in that case. That I'm not sure I feel comfortable with that. What do you think, Dr.
I can
Mike?
understand that.
Can I ask, we were talking about the thing on the refrigerator.
Yeah.
And you said Wisconsin does not give it legal. Does Wisconsin not hold it against a doctor who doesn't respect the thing? Or does Wisconsin not respect the thing itself?
This is something that lawyers get to talk about. I'm not aware of any lawsuits either way with respect to the document.
Oh,
But that's what lawyers at some systems are concerned about.
Oh, okay.
Should we do this or shouldn't we do it? Pulse is recognized in Illinois. There's a large system here in Wisconsin that also has clinics in Illinois. So the Illinois lawyers say if a patient comes from Wisconsin with a pulse order, we're not gonna follow it because it's not recognized by the state. Now, once again, whatever you do, there's potential liability. Why aren't they following the order? Well, their excuse is Wisconsin doesn't recognize it. but it still really represents the patient's wishes.
Right.
So either way, I think you're in a bind. Doctors that are south of the border that are part of the system aren't really happy with that decision because they would like to honor the patient's choices.
I have a sort of a, Barbara Hill, I don't think would mind my saying this, but she did say when Alex had his stroke that Teresa and the nurse were there within a minute and a half. Which is
I'm gonna
reassuring.
go get the handouts.
Sure.
And here's,
Yeah.
I just have to.
Sure. I did want to say that, you know, many of you already have advanced directives. Some of you apparently do not. But if you haven't already, you know, advanced directives are not just for people my age, they're for any adult. So when you share this information with your family or younger friends, you need to assure them that they should consider this also. Because any of us, and this is actually about somebody that was diagnosed at age in his upper 30s with metastatic lung cancer, and he knew he was going to die, and how that's his wife, and how they coped with it. They both happen to be physicians, and one of the things that she learned from this experience, and her husband did before he died too, is that patients always have choices, and sometimes you have to, you know, because there were certain things he wanted, and there was certain, well, it was really all about him, not about her. But they learned that you gotta listen to the patient as to what the patient wants. When it's not an emergency, it's an emergency, you gotta take care of the emergency. So I don't know if you wanna listen to this or not as a TED Talk. You do, okay. I'll see if the right spot, okay. All I have to do, and it'd be nice if I could do that, but that's not gonna work. Where is that little, let's see, let's try this. Nope, that didn't do it. Well.
Can you
Thank
touch,
you, Kathy.
can you touch the
No.
computer, the laptop there? Touch the
Yeah, I'm trying
thing on the
that.
lap?
Oh, I saw a little arrow.
There you go.
There.
she is.
What makes life worth living in the face of death? And now we gotta do something about the volume.
Yes, if you want one of these for a family member, I'm happy to.
Well, according to this, the volume's all the way up, but it sure doesn't sound that way to me.
Sometimes you have to.
See, I got the volume at 100.
Yeah. Where's the volume on here? Well, technology.
It says something on the top of the screen about speakers.
It's what?
There's a sign that says speakers up there on the top of the screen, and they gotta be turned on.
No, that's people,
Old
people.
people, okay.
Yeah, according to this, the
Yeah.
speaker it's on,
Yeah,
so.
there you go, all the way up.
All the way up, but I know that when you connect with a computer, it can sometimes not, the volume often is a problem. Shoot.
No. I wanted to make sure it was really at the top end, which it
Yeah.
is, but, well, sorry about that.
Well, people can,
Yes,
Which one is
actually,
it?
I will, yeah, and I can,
What's your handout?
what's what?
What's your handout?
Oh, hang on. This is pretty much the information that I gave you. If you want an extra one to give somebody, I'm happy to do that.
And I'm not pushing this book. This book's actually from the library, and it was written by her husband. She finished the book because he died before he finished the book. And the title is When Breath Becomes Air.
And it deals with the book?
This deals with his dying with the metastatic lung cancer.
Oh, okay.
And that's the wife
I
that
see,
then gave
I
a
see.
TED talk about this and has done other things that, like I said, one of the things she learned was that patients actually have choices. And in his case in particular, he wanted to practice as long as he could. So the chemotherapy was adjusted, so because his chemotherapy would have been very disabling. And he knew that it wasn't gonna cure him anyhow. So this way he had less harsh chemotherapy.
I know, I'm sorry about that. It can be such a problem. At Osher too, I know we have the same thing, trying to get the volume. And I can read off the site if you want to write it down on your, I have a pen. It is TEDMed, TEDMED.com /talks/show. I wonder what we could, if we could just give them a name.
You could just enter her name, there it is, when
okay.
Air makes,
Yes.
Oh, this is her last name, yeah.
just search her name.
Yeah.
You touch that, the name of the program came up.
Oh.
You touched something and it
Yes.
came up on the screen. There, what makes life worth living in the face of death. And then you'll find it that way.
Yeah.
Okay.
If you have questions, don't hesitate to give me a call, and but I really urge you to, to think about this and talk to your family, and and if you're not ready now for it, well, then you have the information when you are. So to make a decision about having a DNR order. If you think sometime in the future, but you're not ready yet, fine.
There is a response you should not let your doctor give you. It's too soon to talk about it.
Absolutely, yes.
Because it may become too late. There's nothing wrong with talking about DNR orders.
Absolutely.
And if the doctor doesn't want to talk about it, you can ask, can they refer you to a facilitator?
There you go.
That's a person trained to facilitate the conversation. Their job is not to tell you what to do, but their job is to help you think about what's important to you. Because you are president of your healthcare.
Right. Yeah, it's really just taking control of that part of your life.
And at other presentations, one other presentation, including a doctor, we were told that usually people wait kind of until they're really ready for, and they perhaps have a diagnosis that is really serious and that sort of thing. But if there's any piece of joy yet in their life that they think would be worth pursuing, even if they have half a stroke or something.
But they can, and they can, yeah. And the DNR order, remember, only refers to that.
The cardiac arrest
the heart stopping or the breathing.
The breathing, it's not the brain.
It's nothing with the brain. It's with,
the breathing
not working.
But at any age, you should have a healthcare power of attorney just in case. And you may want to look at, there's a book, The Life and Death of Nancy, Long Goodbye, The Deaths of Nancy Cruzan. And she was 32 and she died.
Well, I hope this was helpful, and
thank you all very much.
if there are, well, you know what? It's also going to be on 955. So if you tell people that there's going to be that you went to this excellent thing.
Thank you very much.
Thank you, Dr. Lang.
Anything else?
It was so great to have Phil in.
Okay.
So I appreciate it. Yeah, well, to meet you.